My name's Robert Grilly, I'm 32 years old. It's now been 9 months since my microdiscectomy. It's been roughly 15 months since I hurt my back. Well, I just had a nasty turn while I was surfing, a little bit of instability and my back just twisted. Yeah, it just felt like a bit of an awkward crunch, and that was that. My left leg was pretty much immobile. Basically, it was just a really severe cramp affecting all the muscles down the back of my left leg. Awkward to sit, awkward to lie. It's really restrictive in every manner. From morning to night, getting my socks on was a big ordeal. And sitting down, definitely not getting any pants on standing up, or couldn't tie my shoelaces. Getting a jumper over my head. It was all very hard work in the beginning. There was pretty much no chance of work while I was feeling at my worst. I'm an electrician. Basically, I could walk, but that was with a severe limp. Sports were out of the question. Picking up a racket or a bat of any kind, no way. No way I could surf, no. I went through a process of trying different alternate therapies. I had physio, chiropractic, and after a bit of a struggle I decided to go for an MRI, and that was when more serious problems were discovered. It was a bulging disc at L5, and it was pressing on the S1 nerve down my left leg. And that was when I was referred to an orthopaedic surgeon, and he pointed out directly to me that this was a kind of a nasty injury and it wouldn't go away without a lot of work or an operation.
This is a true and common story. When a lumbar disc is damaged, the softer middle part of the disc or parts of the outer disc can extend outwards and press on spinal nerves. This can cause pain, changes in sensation and muscle weakness. A microdiscectomy procedure is designed to relieve pain and other symptoms by removing damaged disc material which is pushing on nerves. An incision approximately 1.5 to 5 centimetres long is made in the middle of the back at the level of the injured disc. Occasionally, a small part of the bone may also be removed to improve the surgeon's access and to help relieve nerve pressure. A small incision is then made in the disc. Damaged parts of the disc which are pushing on the nerves are carefully removed. This alleviates nerve pain and improves mechanical function of the spine. Healthy disc material is left intact. The disc is allowed to heal without sutures. The wound is then closed to complete the procedure, which usually takes about 90 minutes. Possible complications of the operation include, but are not limited to, wound infection, leakage of cerebrospinal fluid from your spine, deep venous thrombosis or blood clots, nerve root injury leading to movement problems, pain, changes in sensation or loss of function, reaction to anaesthetics or drug therapy, excessive bleeding, spinal instability, hematoma or bruising, anterior perforation of the annulus fibrosus with injury to the major blood vessels, and spondylodiscitis. Some of these conditions are serious and ongoing, while others resolve over time. If you are concerned about possible complications, speak to your surgical team prior to agreeing to have the operation.
On first suggestion that I might need an operation, I was kind of a little bit apprehensive, because I was still hoping to the death that it could be resolved in another way. But I was given a pretty comprehensive talk through about what the operation involved, and I was convinced. I was convinced that it was a fairly safe procedure and that it would be in my benefit, in my interest to do it. It had been going on for so long that I didn't feel that I was making any forward progress, and I felt that that was kind of my only avenue. From the first time I injured my back until the operation, I left it about 8 months.
While success rates vary from patient to patient and depend on the circumstances of each individual case, A respected study of 374 microdiscectomy patients found a success rate of 98% for relief of symptoms, absence of painkillers and patient satisfaction. Conservatively, research suggests there is an 80% chance patients will receive good pain relief from this operation. The goal of surgery is to reduce most of the leg pain. 50% of patients may have some residual back pain.
I feel great. It's been 9 months. Pretty much right away I was able to walk, but apart from the operation, the pain in my leg went straight away the day after. Apart from a tiny little bit of tension, there's no pain at all. I won't say it was all easy. It was a procedure, a surgical procedure, and there was a little bit of pain associated with the operation. But the physio had me walking within 12 hours. So I mean, after that it was all up and up. I was able to leave hospital the next morning. I was lucky enough to have a pretty supportive family at home straight after the procedure, and it was basically a slight rehabilitation straight away. Just walking to and from the TV, around the lounge room to start with, to the letterbox within a few weeks, flat level ground, basically just keeping the muscles moving. I think it was about 6 weeks before I was driving a car. The first 3 months are hard, post-operative, but you do have a lot to look forward to if you can get through those first 3 months. Probably the worst thing after having a back operation is that you kind of doubt yourself. Physical ability, physical strength, hopefully it all comes back with a bit of time and lots of rehab. I started seeing a physio a couple of months after the operation, and it's ongoing. Work on abdominal muscles and working with a fitness ball. Work in the pool predominantly. Basically after I think 4 or 5 months I was able to go back comfortably to do my work as an electrician. Well, my advice to anyone in the post-operative stage would just to follow instructions and do everything that you're told. Don't do anything that you shouldn't do, and do everything that you should do. Slowly, I can basically get away with whatever I want these days. I'm back into work, I'm back into play and sport. It's been life-changing. Yeah, can't say enough for the procedure. It's turned me around.